Hi, it's me, Karen. I'm an international student at Seneca College. I made this video to discuss weekly learning progress in NLM 106. Join me as I list down some important viewpoints that I have learned while studying nursing informatics. Let's start off with week 2. Technology has massively influenced the healthcare sector with the highly commendable benefits towards patient care. Their combination undoubtedly supported medical profession to provide safe and advanced care to patients worldwide. Nursing informatics is the integration of nursing, computer, and information into the nursing profession that aid to proper dissemination and communication of data and knowledge that focused on a better quality of patient care. Meanwhile, health information has a broader range of integration with healthcare, computer, and information to aid in the management of healthcare information. Due to the positive effect of this collaboration, increasing numbers of hospitals globally prefers to use the electronic health records as part of their system, as well as encouraging their staffs to be accustomed with the system enhancement through trainings and simulations. EHR has been an important aid to connect the gap between knowledge, education, and skills towards nursing care, and some of the benefits includes clear and concise documentation to eliminate mistakes while carrying out orders. Nurses will be relieved from lengthy hours of redundant documentations, resulting to more time for patient care, decreasing the door-to-treatment turnaround time due to the availability of patients' complete medical report in the system. Furthermore, the improvement of coordination among the healthcare members by easily identifying the weak points and provide immediate solution. I personally was able to see how technology progressed, from dealing with funny handwritings of the physicians and the routine-like incident report of nurses due to the wrong interpretations of the orders, from manual documentations resulting to lengthy hours of overtime and the fatigue that the nurses has to go through, leading to the lower quality of patient care, from unnecessary delays of treatments or surgery due to the wrong or late dissemination of patients' medical reports. All of this and more are the issues that are being addressed by the modern healthcare technology that aids to eliminate these issues to a better quality of patient care. As someone who understands the importance of nursing informatics and patient care, it is just imperative that I take part on empowering others on how to improve nursing care to our patients. Let's move on to week 3. There are different nursing informatic roles in Canada. A nurse informaticist who gains their title through practical experience, and an informatics nurse specialist who obtain their title after graduating in higher education related to nursing informatics. While both roles involve the ability to understand the importance of nursing information, they differ according to their level of experience and educational background. The Canadian Association of Schools of Nursing, or CASN, and the Canadian Nursing Association, or CNA, are working hand in hand to support this professional organization and to promote high quality of care to patients through enhanced integration of healthcare practice, knowledge, and technology. CNA requires professional nurses to be competent with nursing informatics, while CASN encourages students to apprehend the primary skills such as information and communication while utilizing the technology. Looking at the trend of science and technology, it is indispensable for nurses to keep themselves abreast with the never-ending development in order to keep their knowledge and skills up to date and maintain the confidence in providing care to patients. Nowadays, with the help of advanced technology, new nurses no longer have to go through all this, but instead, they have to make sure that they are competent enough to apply the combination of their education, knowledge, and skills while taking advantage of the technology to provide enhanced nursing care to patients. Down to the last week of this reflection video is week 4. Recognizing the functionality of basic computer helps the nurses to understand the importance of each part. Through this understanding, nurses will be able to know how to properly secure the data they have collected from the patient, access resources from the computer's memory, and to communicate with the other healthcare provider using technology. I remember during my early years in nursing profession, we need to carry this much of the patient's file just to know the patient well. Plus the fact that we do get 20 to 40 patients per shift. Sounds crazy, right? But that's true. Young nurses nowadays are very fortunate because they won't experience that anymore. From a thick and heavy pile of documents to iPad or computer on wheels, which now we call COW. It is now accessible to each station for them to use. You see, these devices provide extensive lists of data that are practical, space and time saving, and very accessible. Who wouldn't want that, right?
Going back to the basic parts and functionality of the computer, there are two functions of a computer, input and the output. Input is simply installing all the information to the system to process or to store data using input devices like keyboards, mouse, and microphones, while output displays the products of input that is being processed by output devices like printer, monitor, projector, and a lot more.
The essential hardware of the computer is like the internal organs of the human body, and it keeps the system working using its individual function. The Central Processing Unit, or CPU, is the essential hardware components of a computer that acts as the brain of the whole system that processes information and gives commands. Just like the human brain, the motherboard contains random access memory, or what we call RAM. It acts as a short-term memory while the hard drive serves as the long-term memory of the CPU. RAM is used for calculations but has no capability to store files when the computer shuts off. In contrast, hard drive can store data for a long time even if you shut down the computer. The motherboard can be upgraded by adding expansion cards for better performance according to the user's need. Lastly, network hardware like routers, hubs, and switches allows different computers to be connected to each other with one main server.
My weekly learning programs in nursing informatics helped me to comprehend in an in-depth manner the connection of nursing and technology and how I can apply it with my profession. Also, I have figured out how my previous experience can be used to empower my future mentee and colleagues in embracing the latest technology in my career and taking advantage out of it. My goal in the coming years is to provide valuable contribution that may aid to close the gap in healthcare settings, improve communication among healthcare members, and providing accurate information and resources that patients can easily access.
These are my collective insights and learnings in NLM 106. Thank you for taking some of your precious time listening. Once again, this is Karen, your KBB student in Nursing Informatics, Seneca College.